This is Average Joe PT, and we're here to reduce anxiety, improve function, and master your pain. Aren't we, Skully?
We're in the clinic today.
That's right. Today we are in the clinic. We are going to do our fourth installment of our Snapping Hip Syndrome series. And this is all about treatment techniques that you're going to receive in the physical therapy clinic. Now, if you're new to this channel, we'd love to have you subscribe down below, hit the bell. We bring content once or twice a week. We do lives all over the place here in Average Joe PT. So if you're new, we'd love to have you hit that bell and be part of our family. But let's go ahead, hold on. We're going to get started right now. We are back, and we're going to go ahead and get started with all types of exercises that you're going to receive in the physical therapy clinic for Snapping Hip Syndrome. So I got to bring in my good friend, Ty. Come on in, Ty. All right, so we're going to go ahead and get started with all types of treatments that you're going to receive in the physical therapy clinic. All right, Skully. Now, seriously, this is what we're going to do today, and I want you to relax. I got my good friend Ty here that works with me, and we're going to go ahead and show some of the different techniques that we can do in the physical therapy clinic.
You gotta be kidding me. You're leaving me for someone else.
Calm down. Calm down. Everything's going to be fine. You don't have to worry about this at all.
I can't believe you're getting rid of me. This is ridiculous.
No, I'm not getting rid of you. I know, that's not it at all. You don't have your entire body. What am I supposed to do?
Oh, yeah, that's what it is. Sure.
Let me just bring in Ty, all right? And you guys can go ahead, mano to mano. You can go ahead and have a conversation, and everything will hopefully be okay.
All right, bring him in.
Nice to finally meet you. I've seen you quite a bit.
Are you taking my spot?
No. Don't even worry about it. He's using me for my kid.
He uses me, too. I'm the star of the show.
No. You are definitely the star of this show. In fact, I don't even think I'm going to last more than just this one episode.
Skully, what did you think about that? He's pretty cool, isn't he?
We came to an understanding.
Yeah, I think you guys could probably, do some stuff. He's a physical therapist. You can always use a skull. What do you think?
One skull, one therapist. He can go get his own.
He can go get his own? Oh, come on, Skully. Come on, you guys are doing great, weren't you?
We know who's the real star of the show.
Fine. I know you're partial to me, and I appreciate that. This is exactly, it's a match made in at least Skeleton's life.
It's a match made in something I don't know what.
All right. I think everything's going to be fine. Isn't that right, Skully?
Come on, let's get this going.
All right, so let's go ahead and we're going to get started with the show. Well, the first thing we're going to do, we're going to go ahead and show you the types of tests that we do and the stretches that we do for Snapping Hip Syndrome. So come on over here, Ty. Let's go ahead and have you lie up here on your back. We're going to scoot up towards the edge of the table. We're going to start off with that Thomas test. We're going to go ahead and bring this left knee towards your chest. And right now we're looking at the right side. So we're going to see exactly how this right side is looking. If you have a problem, you might have your leg staying up like this. That's that hip muscle really tight. Your leg might be out to the side. That's that muscle out to the side, as well as the IT band giving you that tightness. Now I'm going to go ahead and leave a link right up here. You see that pic right there? That is the TFL. That's why this is out to the side. Now with Ty doesn't have that issue. But if you did, your leg would be plopped out to the side. As well as your leg would be up like this. If you see this pic right here, this is your iliopsoas muscle. If that's tight, your knee will not stay off the table. It'll drop right on down when it's not tight. See how this is normal. This is not normal. Pretty simple, right? And we're gonna go ahead and do those stretches right now for that particular tightness. Stick around, come on now. So literally, this is what he's doing. The test is exactly what the stretch is. Now you can do it like this, where it's nice and convenient like we do in the clinic, or if you look at my last playlist, I go over the treatment techniques that you can do at home in Snapping Hip video series number 2. So you can go ahead and look at that right now. I'm gonna leave a link up there. You go ahead and click on that. So let's go ahead, Ty. We're going to go ahead and lie on your side now, facing towards the mirror. Now we're going to go ahead and look at this other type of muscle group. And this is going to be along that iliotibial band. This is that external snapping hip syndrome that I talked about in the very first video. And we're going to go ahead and straighten this leg right on out. If this leg is not nicely dropped down towards the side like it is, and it's kind of stuck up here, you got an issue with those muscles right on that side, as well as that tissue is very tight in that area. And we're going to want to do a few things here in the clinic. We're going to want to do a good old-fashioned foam roll. That's right. We got to beat on the patients now. We're going to go ahead and roll that area. And we want to do that at least 3 to 5 minutes. Now you can do the same exact technique at home. In my playlist, if you look under hip issues, you will find the same exact technique. I just used a rolling pin at home. We're using something fancy in the clinic. So I want you to stay tuned. I'm going to show you some higher tech stuff that we do right now. All right, folks, we are back. We're going to show you some of the higher tech stuff that we do in the physical therapy clinic for snapping hip syndrome. Now, we're going to be specifically looking at external snapping hip syndrome. We're going to be using ultrasound machines right now. So let's go ahead. Here we go. All right, so we got the sound head here. We got some good old-fashioned gel. And we're going to go ahead and set up the parameters that we want to do for the ultrasound itself. All right, we are ready. So what we're going to do normally, we're going to go ahead and get this guy nice and prepped, or the missus nice and prepped, depending on who you're actually treating. Get yourself in a nice, comfortable position. That's what your physical therapist should always do, because the guy do these a million times a day. Now this is a ultrasound that's not diagnostic. This is not an image that's coming out of this. We're not putting this on baby. That's a different kind of ultrasound. This is what we're going to use this for is a thermal effect, a heating effect. Get that tissue warmed up. Then we can go ahead and do that massage roll that we showed earlier. Then we can also do some stretching. So this is a nice little treatment that we can do prior to doing all that other stuff. This is exactly how it's going to work. So we'll put the gel right on the old sound head, and we would go ahead and normally expose the area that we want to treat. In this case, I'm going to leave a little picture up there. That's the TFL, as well as the IT band. TFL, tensor fascia lata, and iliotibial band. And those two tendons coming on down in that can cause a lot of that external snapping hip syndrome. We're going to want to go ahead and just start to sound that wave around in there. And it should be no more than twice the size of that head. So if you see your therapist that's kind of going all over the place, they're not doing what they should be doing, you're not going to heat up that area. It's a very small little sound head. So you're only going to use about twice the size of that sound head, and that's about it. So it's a nice, small, localized area that we will go ahead and do the ultrasound with. All right, folks, our next treatment that you're probably going to see in the physical therapy clinic on snapping hip syndrome is the tape. This is the same tape that I show you guys all the time with the home treatment techniques. This is Leuko Tape, or also known as Leuko Tape. It has the white cover roll and the brown tape. What we're gonna do is we're gonna go ahead and unload or shorten that iliotibial band. See right up there, that little pick that I have? Oh, let's do it the other side because Ty's right there. So we're gonna go ahead and put it on that side right there so you can go ahead and have a good idea of what we're taping. All right, Ty, let's go ahead and have you lie on your side. So we're gonna simulate this taping right now. Pretty simple. You could have your family member do this at home if you wanted to. So we're gonna go ahead and put one nice long piece. Remember, that iliotibial band, the IT band, is all the way from the hip, all the way down past that knee joint. It's a very long fibrous tissue. And normally, obviously, you would put this on the person's skin. You wouldn't put it on their pant leg. We're gonna go ahead, do that nice little white piece just like that. I normally do a nice little Y or V pattern. This first white cover roll is just to protect the skin because you don't want that skin to get irritated. If your skin does get irritated, you don't want to do this one at home. You go ahead and stop doing it immediately because this should not irritate you. But I'm going to leave a link below like I always do so you can simply buy this tape. It's like probably 15 bucks or something like that on Amazon. So you go ahead and look at my comment section and you can go ahead and see this tape right there. And this is the good stuff. This is a very thick, it's unlike the kinesio tape, which is the elastic type tape. You're gonna go ahead and you're just gonna, nice little spot right down there, right where the end of that knee is. That's where you're gonna start that and kind of give a nice little rub. Then you're just gonna kind of pull right up on your tissue and then just lay it on down. And it's literally that simple. And you're going to wear it for at least 2 days, as long as it doesn't get itchy or scratchy. That will hopefully help reduce some of the stress along this area so that you can resolve that snapping hip syndrome. Skully and I want you to hit this next card right on up here. This is the other 3 videos that are in our snapping hip syndrome series. And go ahead and click on that right now. But if you're new to the channel, we'd love to have you hit that subscribe button and hit the bell. We bring content once or twice a week. We do our lives on Wednesdays, Thursdays, and Fridays. But until next time, Skully and I want you to look up and keep smiling. See you next time, folks. What do you think, Skully?
That's a wrap for this one, folks.
Yep. Keep smiling. See ya.